Nearly 3 years into the COVID pandemic, the virus is still evolving.
Scientists are working to answer one of the most common questions. How much protection does a previous COVID infection provide?
The most comprehensive analysis yet was released this week involving 65 studies from 19 countries. UW Health's Chief Quality Officer, Dr. Jeff Pothof, is back with us for his weekly visit.
Hi,
Good to
Dr.
see you.
Pothof.
Good to see you guys.
So what did we learn from this study?
Yeah, so what we're learning from this study is when we go back to when the vaccine first came out and we looked at natural immunity versus vaccine-induced immunity, vaccine-induced immunity won out. It provided longer protection. It was a better option. But things have changed now. We've got these Omicron subvariants, and vaccines aren't quite as good as they used to be. We used to not, get symptoms at all. And now the protection against vaccines really is against severe disease, hospitalization. And when we look at this, large meta-analysis, it looks like, at least now, if you're infected with COVID-19 and you live to tell about it, you probably have about as good of protection against severe disease. You could get COVID again, but severe disease for about 10 months. So they're comparable there. That's good news. That likely also kind of explains why we've seen COVID starting to calm down a little bit, because most people have either been vaccinated or they've had COVID, and immunity is decent against severe infection, whichever path you choose.
So if I had my antibodies checked, would I be able to get some measure of how protected I am?
Kind of. There's lots of different antibodies. It's complicated how your immune system works, but you can look at like neutralizing antibodies and you can say, this is the level that I'm at. What's a little bit harder is to say in a specific person what level protects against severe, disease, but they can see after an infection or after a vaccine, those antibody levels increasing.
Wow. And it seems so random. I mean, there's been people in the newsroom that got COVID, fully vaccinated, and a little sniffle. Other people fully vaccinated and got pretty sick.
Absolutely, and that's what's so hard about medicine and diseases is that, not every one of us is created the same. We're all kind of like a custom model, and then you apply this disease to these custom models, you get different things. But when you look at, large groups of people, and that's what's important, because we all have our own COVID stories, but you have to look across, thousands and tens of thousands of people to say, in general, this is kind of the way that things are working.
So if you've had COVID and you have the antibodies, you have some protection, and then you get vaccinated, do you get even more robust protection?
So technically, yes. So your antibody levels would go up, but then translating that into what does it mean? It might mean that your likelihood of actually getting sick when you come in contact with COVID-19 could decrease, but individuals could be different. It could mean that your antibody level is higher, but you still just have fairly equivalent protection against severe disease, hospitalization, even though from a test perspective, you look like you're doing better than, say, someone who didn't get that booster.
And if a new variant comes along, is that a whole different story?
Well, I think this is where natural immunity will fall apart a little bit. So let's say in the future, if we get to the state where we're trying to go, where it's once a year vaccination, we could look and see what's going on in a different part of the world and say, you know what, there's this new variant, this is what it is, it looks like it's going to be dominant. We could create a booster that protects against that variant, and you might get better protection than being vaccinated versus being unvaccinated and now just getting that variant and getting sick from it.
And we're still dealing with Omicron and variants of Omicron right now.
So far, everything is still the lineage of Omicron. They're all coming from Omicron.
And Moderna's going to pay for the vaccine if you're uninsured.
This is an important thing, because one of the things we were worried about, we learned through COVID that, the people who don't get vaccinated, it's not just a problem for them, it's a problem for all the rest of us. So if folks couldn't afford the vaccine, that could create some problem for the rest of us. Moderna's saying, hey, if you can't afford it, you're not insured, we're going to take care of that. That helps all of us.
Good news for now.
That is good news.
Doctor, thanks for being with us.